Chiropractic therapy, a CAM therapy, presented by Robert Heimberger. What is CAM therapy? CAM therapy is also known as Complementary and Alternative Medicine. The National Center of Complementary and Integrative Health defines CAM therapy as a group of diverse medical and healthcare systems, practices, and products that are not generally considered part of conventional medicine. There are many unanswered questions regarding certain CAM therapies, including the safety of some therapies, and if the therapy is providing the necessary benefits for which they are used for. In 1895, chiropractic treatment began as a profession by the founder, Daniel David Palmer. Palmer treated a janitor using chiropractic method and restored the janitor's hearing. Palmer never claimed to be the first to manipulate the human body for a cure of certain diseases, but he did believe that he was the first to use specific contact points as short leverage points for making more specific spinal adjustments. Chiropractic CAM therapy is a therapy of both body and mind practices. Indications for use in chiropractic therapy. Chiropractic therapy itself can be defined as a type of therapy that, based on procedure that evaluates causative factors and a biomechanical and structural derangements of the spine that may affect the nervous system and organs. By making adjustments to the spine, chiropractors are able to relieve pressure of the visceral organs to allow them to function more effectively, or relieve pressure on joints to decrease pain and improve range of motion. Patients may seek chiropractic therapy when they are experiencing a variety of ailments, including low back pain, headaches, neck pain, upper and lower joint conditions, and whiplash-associated disorders. What are some side effects of CAM therapy's chiropractic method? There are not many side effects associated with this type of therapy, but some may include temporary headaches, tiredness, or discomfort in parts of the body that were treated. Serious side effects may include stroke, cauda equina syndrome, and worsening of herniated discs. Contraindications to chiropractic therapy. The World Health Organization describes contraindications to chiropractic treatment as where any use of joint manipulation or mobilization is inappropriate because it places the patient at undue risk. These contraindications include articular derangements, bone weakening and destructive disorders, circulatory and hematologic disorders, neurologic disorders, and psychological disorders. Patients receiving therapy within conjunction of their primary doctor and a chiropractor, which may assist in the treatment of any adverse effects and prevent patients with contraindications from relieving treatment. Chiropractic therapy for cultures. Chiropractic therapy is one of the most used and researched CAM therapies utilized by the public. Chiropractic therapy serves all genders, races, cultures, and ethnicities. Individuals requiring joint manipulation isn't specifically related to a person's cultural background. To increase patients from other cultures to pursue therapy, it is imperative that providers in the field become more diverse themselves to facilitate a greater comfort level between provider and patient during care. Health teaching for chiropractic therapy. It is important that patients do not pursue chiropractic therapy without the proper health teaching. Patients should be taught the need to inform the chiropractor of any medical conditions that they may have. Tell the chiropractor about any medications that they are using, including prescriptions, over-the-counter medications, and dietary supplements. Patients should be informed to question any dietary supplements that the chiropractor may suggest, as it may interact with other medications that they may be on. Research found supporting chiropractic therapy The research done was completed to evaluate the overall effectiveness of chiropractic therapy. This research shows that even though chiropractic therapy is useful, it is not effective as a main treatment option for chronic pain. Research found and observed that patients experiencing chronic pain who utilized chiropractic therapy found a positive outcome to this CAMP therapy. Participants in the study noticed an increased awareness, acceptance of the chronic nature of pain, and the attention to the need to take responsibility of their own health.